with whom I've had the pleasure of conceiving and building this program, and she'll provide some additional comments from the community perspective.
Thanks, Bug. It continues to be a great journey working alongside of the team whose collective expertise in program development and clinical work and research is quite outstanding. It feels like a bit of a ray of hope and light to be celebrating today in the midst of sort of this global trauma and ill health period. To be celebrating Pathways to Peers, which is such an innovative program partnership between hospital and community players, and the RBC Foundation strongly supporting it. Along with the RBC, Stella's Place, from our part in terms of our resources, has had support from a number of other private donors, including the Kimmel Foundation. Thanks, Warren, if you're in the audience today. As I was introduced, I'm the founding executive director of Stella's Place, and I think we have quite a few of our team on the platform with us this afternoon, including one Gary Mariuki, who is taking the helm, or has taken the helm from me since my retirement a month ago. So welcome to all of those folks, as well as other community partners. A little bit of history to set the stage. 10 years ago, and even 5 years ago, if you looked at the community mental health service offerings, there really were no services specifically designed for 16 to 29-year-olds, young adults, even though that's a time when mental health issues really begin to emerge for folks. So as Bug mentioned, hospital emergency departments are open 24/7. So of course, it's no surprise that young folks would be going to emergency departments. And as Bug says, that kind of disconnect between what a young person needs at that time of distress and what the emergency department really realistically can offer was really a rich area for innovation. So that's what we did. We connected up with Bug and Shelley at SREMI and the team there, and pushed along to innovate the way that Stella's Place does, to work with young folks to identify how to address some of the gaps in the mental health service sector. So that's really where Stella's Place comes in. And our response to lots of these gaps for young folks has been to develop our integrated, accessible, community-based hub in downtown Toronto that offers a full menu of peer clinical wellness services to specifically that 16 to 29 population. Yes, we have virtual and face-to-face services, and we've been offering virtual services actually pre-pandemic, which is something that we were told by young folks who we listened to very intently around how we build programming. They said it was crucial that we have online access. We've also heard consistently from hundreds of young adults over the last 10 years that they want to be met by, supported by, and connected with peers with mental health experience, lived experience of mental health issues, in order to feel heard and understood in a deep way. They get each other. So Stella's Place was built with peer support as a core foundation, and 5 years ago we started to co-design a peer support training program. And since then, I think we've trained, I would say, close to 400 young folks around the GTA who can take on skilled roles as peer supporters in hospital, community, and education settings. So that's a significant move forward in the sector to see peer supporters as a core element of the workforce. The other thing that we do, besides, in addition to the menu of clinical and wellness services and peer support, is that we work with partners to really look at how peer roles can be incorporated into the work that they do. And that's a great example is Pathway to Peers. They were looking to find a way to increase the relevance of the experience and the impact of the experience in the emergency department. And so we joined forces and have had, I think, probably 5 years since that first research project application went in. And since then, we've really worked to develop the program, the research design, building new roles at Sinai Health and practices to allow peer supporters to be really a vital part of the emergency room team. And also that sort of smooth and warm pathway, intentional pathway to Stella's Place and other community programs is really, really important. So right now, Yolanda and Mahalia are walking beside and responding to the needs of hundreds of folks, as Bug says, at Sinai ED. And I think we can really think of Pathway to Peers as a stunning example of effective community hospital partnership, innovation and practice building that really centers peer support as an impactful component of the mental health and health workforce, which is really a broader way of thinking about how we can build a really effective and responsive workforce. So really together we're demonstrating peer support makes a difference for young people, and really deep appreciation to our partners and supporters. And back to you, Shannon, so we can hear from the team that does the real work.
Thank you, Dr. Bug. Thank you, Jenny. That was very insightful. And I now want to introduce RBC Olympian Erin Vladimir. She is a two-time Paralympian in the sport of para-alpine skiing, and she's currently a student at University of Toronto with her eyes set on a new prize. Welcome, Erin.
Thanks, Shannon. I'm really excited to be joining you today virtually to talk about mental health and well-being. I worked in health promotion for the first 2 years of my undergraduate degree at U of T. I currently facilitate weekly mindful meditation classes at the university, and much of my work at RBC is in our wellness space. While conversations around mental health and well-being are nothing new, I've noticed over the past months that many companies and communities are talking about it in new ways and putting meaningful work into integrating and prioritizing mental health and well-being into our everyday lives. While this is amazing, we know that many people do not have access to resources and supports for their mental health. This is particularly prevalent among youth, and while the COVID-19 pandemic has exacerbated mental health challenges and access issues, this crisis is nothing new, and the problem is much deeper than the pandemic, which is why programs like the RBC Pathways to Peers are so important. Although I have a background in health and wellness, I'm joining you today as an expert of me and my experiences as a young person, as a former high-performance athlete, a current university student, a person with a disability, and a recovering perfectionist. And while my personal experiences and circumstances aren't necessarily reflective of many of the youth in our community, there is no one type of youth in our community or any community. We are all multidimensional people, and no matter who we are, we experiencing challenges to our mental health and well-being. I grew up, like many others, in a culture where we see time as money, productivity as self-worth, and exhaustion as a status symbol. We champion hard work and efficiency and are on a never-ending journey of self-optimization. I once thought of work ethic, discipline, and dedication as my greatest strengths, partly because I know that they played a huge role in my career as a high-performance athlete, but also because they were and still are the qualities that many people find commendable about me and other Olympic and Paralympic athletes. Following my retirement from high-performance sport in 2018, I went back to university and took a stab at things I wasn't able to do when I was a full-time athlete, including my role at RBC. All of my endeavors were helped by my work ethic, discipline, and dedication, which was developed during my 6-year career with the Canadian Para-Alpine Ski Team. It wasn't until recently that I begun to recognize that while these qualities and my mindset have been very helpful to me, this way of being and thinking is one of the greatest challenges to my mental health and well-being. Constantly striving to do more and be better, even unconsciously, is exhausting, and it takes a toll on our health and well-being. This type of mindset and lifestyle will inevitably lead to burnout and can exacerbate feelings of stress or anxiety when we are not producing or achieving. When I personally go through a period of time when I have low energy, am irritable, or am not being my best self, it always feels like the result of something I did wrong, or that there was something that I could have done better in my self-care routine or schedule. And when this happens, I used to turn to tweaking or improving something in my routine to try to address the cause of whatever I was experiencing or feeling in an effort to prevent it from happening again. But it inevitably did, because stress, anxiety, and every other uncomfortable emotion that we've ever felt is part of the human experience. We often get so caught up with being productive and efficient in our personal and professional lives that it's easy to forget that we're human beings, not human doings. Taking the time to check in and stay present with our experience and discomfort without immediately trying to make them different or find a solution can be really difficult, but it's such an important component of self-care and healing. I have begun to accept that I'm never going to be able to understand or master myself or my emotions completely. No matter what I do or don't do, I will never be immune from the full spectrum of human emotion or challenges to my mental health. Through practicing self-compassion and non-judgment towards myself, it has become easier for me to give myself permission to rest, relax, and accept that there are days or weeks at a time when I'm not feeling my best. This allows me to bring flexibility to my habits. Instead of gritting my teeth and pushing through times when I feel challenged, I take a step back and try to give myself what I need in that moment. There's not always clear causes or solutions to my challenges, and accepting this has allowed me to let go of the guilt and shame that comes with not feeling amazing all the time or not being the best version of myself all the time. I'm doing my situational best, and in acknowledging that these challenges are part of being a human, I'm able to be kinder to myself and more vulnerable with others. I'm very fortunate to have people in my life whom I speak with openly on a regular basis about challenges and difficulties. While we always take the time to celebrate the things that are going well, it's discussing the adversity and struggles and our shared humanity that connects us the most. It's in these types of conversations that we feel seen, heard, and understood. If you have a friend, peer, or therapist that you speak to regularly, you know how cathartic it can be to talk to someone about a personal struggle or challenge. Often, we aren't even looking for a solution. We just want to chat and get out of our heads. In speaking to others, we're often able to reframe our mental health and general life challenges as what they are, a part of being human. It takes an immense amount of pressure off of us and often allows us to relate to our experience in a more helpful way. Sometimes it's simply accepting that we're having a moment. Sometimes it's recognizing that there's something in our life that we need to change. And sometimes the challenges we experience are more systemic in nature. Regardless of who we are or what we are or aren't doing to protect our mental health and well-being, though, we're all humans, which means we will be subject to difficult emotions and challenges to our mental health. Sometimes these challenges might be too much for us to deal with on our own. These situations can be difficult because we don't always know when to seek help or how to seek help. These moments can be scary and isolating, and our institutions and healthcare systems are not always designed in ways that best support and serve the types of mental health challenges which we're here today to talk about. I'm sure many of you can agree that there's still a lot of work collectively that we have to do to better support the health and wellness of our society. Some of this has to do with addressing toxic values in work cultures and increasing education on mental health, but some of this has to do with listening to what people want and need and finding innovative ways to better serve them. I think this is exactly what the RBC Pathways to Peer program does. One of the reasons I think it's so great is because it takes into account important aspects of the human experience that sometimes get lost in the name of efficiency. There's so much to say around the topic of mental health and the great work being done through the RBC Pathways to Peers program, but for our purposes today, I'll leave it at that. Thank you all for taking the time to be here today, and thank you for your attention.
Thank you so much, Erin. I especially really like the part where you said that we're human beings, not human doings. That one definitely, that hit me for sure. So we're now going to turn it over to our wonderful panelists who are eager to take your questions. And just a few housekeeping notes. So if you've submitted questions when you RSVP'd, we have those ready to go. And you can also submit questions live through the chat feature on the screen, and they'll go directly to our speakers. And we have received an amazing amount of questions. So if we are unable to get to your question that you registered with your email, someone is going to reach out afterwards and make sure that you do get an answer. And I also want to mention that this discussion doesn't replace professional and medical advice. So please reach out to your doctor or seek support if you do have specific questions that you'd like addressed. Without further ado, please join me in welcoming our panelists. We have Christine Bradshaw, who's an emergency department social worker and our Pathway to Peers project manager. Welcome back, Mahalia Dixon, our peer support worker with the Pathway to Peers program at Sinai Health. Allison Dunning is the Peer Initiatives Manager at Stella's Place, and this Toronto community agency, they put the shared experiences of young people at the center of its care model for addressing mental health issues. And Dr. Andrew Organic is a staff emergency physician at Sinai Health and Scarborough Health Network, and he seeks out patients who meet the criteria for Pathway to Peer support and works with them, with the team to ensure that our community mental health needs are being addressed. And rounding out our panel is RBC Olympian, Erin Vladimir, whom you just heard from. So we're going to go over to our questions, and I want to start with Dr. Organic. So as an experienced ER doctor, can you provide a little bit of context around the work of the emergency department and also how this might affect a young person who is looking for mental health care?
Absolutely. Thanks, Shannon. So it's sort of been hinted at earlier, but emergency departments are usually the first point of contact with the healthcare system for youth that are seeking help with their mental health. Our departments play a critical role in supporting people's mental health, as when they usually come to see us, they're in a complete state of crisis. Although this is part of the service that we provide to our communities, every hospital has a slightly different set of resources available and may be differently equipped to experience and have a different set of experience really in handling the mental health and addictions concerns of youth and young adults. As everyone will know who has been in an emergency department for any reason, they're not really the most relaxing environments. I think it's important for anyone to know coming in that even though we want you to come and see us, we recognize that it isn't always the easiest place to walk into. The care we provide is usually centered around older adults or sometimes children, and may seem a little bit unfriendly for anyone in between. It's a fast-paced environment. There's often a lot of waiting around. Usually they're short interactions with the doctors, so it can sometimes feel a bit unsatisfying. Emergency departments are full of distractions, so it's not unusual for me to be pulled away to deal with something else right when I'm talking to a patient, often mid-sentence. Because it's an unfamiliar environment, many people can get a lack of trust in the team or the system, and sometimes it can feel downright uncomfortable or even scary. Especially since the COVID-19 pandemic, we're seeing a lot of our youth in the department on their own, which sometimes can make this worse. That said, sometimes youth coming in with their parents, supports, or caregivers can feel like they can't properly express themselves. To make this even more challenging, youth and adolescents usually don't really realize that they can tell us absolutely anything about themselves and their health, and with very few exceptions, it will be completely confidential. We won't report back to your parents. So, emergency departments are always there for the communities, but it's essential that we keep in mind that there's always ways that we can improve the care that we provide.
Nice, thank you so much, Dr. Organic. Christine, I want to go to you. Can you please share why the program was created, which does include peer support workers and a community partner?
Sure, thanks. We knew we could do a better job in our responses to our young adult patients presenting to our emergency department. So it's really a program that complements our existing care. We felt it was important to do more in the Emerge because coming to the emergency department is often a person's first attempt at help seeking, and during a pandemic, it may be their only chance for face-to-face interactions. We had to do a really good job when young people come reaching out. So we wanted them to feel heard, understood, and continue to help seek in the future. The foundation of peer support is that of having lived experience. So we hired young adults with mental health and substance use histories themselves that could support and relate to young patients coming into our Emerge. They're trained non-clinical healthcare staff, meaning that they can build a trusting relationship with patients and support them on their journey within the emergency department. And a community partner such as Stella's, it's building this program with a community partner. We have the right tools and awareness to help young adults transition back into the community.
Nice, thank you so much, Christine. Mahalia, I want to go to you because you are a peer support worker. So what is the role of a peer and how do you provide support in the emergency department? And then also after people have left the ED?
For sure, yeah. So the role of a peer is pretty interesting. So essentially at its most broad, we provide any type of lived experience-based support. So anyone who's able to pull from their own experiences of any, specifically mental health or substance use within this context to support another person. So in my role, as Christine was talking about, I provide that non-clinical lived experience-based support. I work with young people 16 to 29, anyone really who accesses Mount Sinai Hospital's emergency department while I'm on shift. But primarily our focus is, of course, with young people who've had experiences, or current experiences, crises, anything like that, with mental health or substance use. But of course, we also recognize that, like Dr. Organic was saying earlier, the Emerge is a really stressful place to be in for so many people, and especially during COVID. Like any type of fear has really been highlighted right now, and it can be really uncomfortable. It takes a lot to come in, and so we recognize that. And so my role is also to support those folks as well. A lot of people are having a tough time, so a lot of folks can also use a little chat to see how we can best support them. So I work alongside like a larger team, the ED team, that includes like the physicians, nurses, nurse practitioners, physician's assistants, and of course, social workers. So a lot of times on a day-to-day basis, I'll work with Dr. Organic, I'll work with Christine, I'll work with Dr. Borgenbog, I'll work with Bug, or with a lot of folks in the Emerge to make sure that young people are able to get the most wholesome and effective care possible. Like Dr. Organic was saying as well, of course, things do stay confidential, but there is also that just like general sharing within the team to make sure that everyone's okay, everyone's doing well, but of course with the consent of the young person involved as well. So my specific role, I tend to, all of the things that I do really come from my own experiences. So a lot of it looks like active listening, it looks like compassion, it looks like sharing coping strategies. It looks like community referrals, anything really that a young person needs to help them get them through their visit through the ED, as well as return them home or whatever it is that they're going in a way that makes most sense for them, in a way that makes them feel like most comfortable and empowered, like they felt that they had a voice while they were in the Emerge, and were able to get the care that they need. So like you were saying as well, a lot of the work also involves doing follow-up care, which is an interesting point of the Emerge. A lot of times you don't really get that afterwards. Like as soon as you're discharged, it's like done, now see your family doctor. And while that definitely is helpful, it's important to have a family doctor and go back and get that further reference. It's also nice to have someone who's able to check in. So next sometimes it's like one day after, it's a week after, a couple weeks after, I do short-term follow-up support to a young person to see if there's anything else that we missed while they were in, anything that you think would be helpful to keep them well. A lot of times as well, it looks like doing further community referrals. So getting them back to places like Stella's place or somewhere else in the community that makes sense for them to be able to get further care in a place that's a little bit more comfortable than coming back to the Emerge regularly. So that's really what that looks like. A lot of the work, of course, is person-centered. It's focused on whatever it is that young person needs of us in that moment, whatever it is that they need, we're here to care for them in that way.
That's awesome. Actually, going off of that, Mahalia, I want to go back to you. So you said, so like stigma is really real and reaching out can be really scary, especially for young people. So how might a young person then approach reaching out for support?
For sure, yeah. So another interesting question, because I think a lot of times when it comes to reaching out for support, it's just as varied as the young person's own individual experience at that time. So I say first, it's always important to give yourself kudos for whatever it is that you're doing, and the fact that you're able to reach out for support takes a lot, especially right now. Being able to muster up the energy to even do anything is really hard. So be able to reach out, use that energy to reach out to take care of yourself, like serious kudos. But it's also recognizing though that what that support can look like really varies based on that young person. So for some folks, it can look like calling a friend or a family member, anyone in your life that you feel you trust, and like let them know sort of what's going on. It's about building those sort of pods, that web of community around you in the best ways possible. It can look like reaching out to your doctor. It can look like reaching out to a community support or a counselor, someone who's able to support you in those ways. It can also look getting back into therapeutic practices, and no, that doesn't always have to look like that standard talk therapy. It could look like anything that makes you feel a little bit better. Do some of that self-care and care for yourself. But we also want to recognize though too, like for folks who are coming into Sinai's Emerge, naming that you're like struggling in some way, naming that you need a little bit of extra support is huge. And we always do our best to try to brush down some of that stigma by validating that it's a real thing that you're going through, that it's hard, and we're here for you. I think a huge part of that, of course, having peers like myself and Yolanda and Emerge, it also like tells you that, like it's okay, right? We've been there, we're going through it currently, lived and living experience, right? So having just someone in general who has lived experience as part of your care team, we feel in some ways also is able to bust down some of that stigma and make people feel a little bit more comfortable with the support that they're accessing.
Oh, sorry. Erin, you were sharing some of your experiences. Can you talk a little bit about the daily tactics that you take day to day to manage your own stress?
Yeah, of course. I sometimes joke that practicing self-care is kind of like a day job or a full-time job for me, because over the years I've really started, experimenting and trying different things that work for me, many of which I began practicing when I was an athlete, because although, it was my job to perform and train physically, a huge component of that is actually also making sure that you're mentally and emotionally well. So I think it's really overwhelming sometimes when I tell everybody some of the things that I do, but all of these things only take a few minutes and they're free. They're things I can do anywhere. And for me, I think the biggest thing also is that I have to be flexible with myself, because sometimes they can become just another thing on my to-do list. So for me, what's really big is practicing mindfulness. So that includes daily kind of my mindset, which I think I don't have necessarily time to go into. I spoke more to it before, but formally that includes meditation, practices of yoga. I make sure to move daily. I have a regular sleep schedule, and I practice gratitude through a journal. Other things that seem so minute, like to me, a regular sleep schedule, hydration, eating well, those are all huge for me. And I think in general, people have to find things that work for them, because there's kind of no universal thing that works for everyone, and a little is better than nothing. And sometimes you don't have time for everything, because things get busy and overwhelming. And my biggest thing that I work on too is sometimes I stress myself out trying to do it all. So it's kind of acknowledging that some days, to help me manage my stress, I'm not going to get to all of those things.
Yeah, for sure. I feel like we can all definitely relate to that. Allison, you work with Stella's Place. So how has Stella's Place made support available virtually, given all the COVID restrictions that we've seen over the last year?
Yeah, so Stella's Place did have to pivot pretty quickly when the pandemic hit almost a year ago. So obviously a lot of our programs and services were originally in person in our Camden Street location in downtown Toronto. And we did have to pivot very quickly in order to make sure that our participants could still receive the support and care that they need. So we've so far relied pretty heavily on a chat-based app that we have called Beanbag Chat. So this is a text-based app that folks can download for free on their iPhone or Android devices, which lets them text in to receive support. And one of the good things about that type of support is that folks can do it very, very confidentially. So folks are often living, especially young folks, are often living in shared spaces or with a parent down the hall and things like that. And sometimes being able to, hop on a phone call with a therapist is not even an option, just because there's so many people in a space that can overhear that conversation. So one of the benefits of this text-based platform is that folks can type in, and it just looks like they're texting on their phone. So they're able to do that in a really confidential way. And that support does connect young folks with peer support workers. So trained folks with lived experience at Stella's Place that are available to offer some coping strategies and resources and compassion and validation from that lived experience lens. And we've also been able to adapt a lot of our clinical programs into an online environment. So we've been able to engage in a bit of a co-design process. So again, we always like to include the perspectives of young people when we're developing new programs. And so when we needed to deliver our clinical programs, like our dialectical behavioral therapy programs in an online environment, we made sure that young adults were still engaged in the co-design process with us. We held a few sessions via Zoom to make sure that we could hear out their perspective and get their input about how to run a program like this in an online environment. It was new to us, and so we really wanted to make sure that we had their voices included in the process. We also continue to offer our yoga fitness programs online. So folks can drop in day of in order to access free yoga once a week and free fitness every other week, facilitated by external instructors, and then also with a peer support worker attending as well, just in case any mental health stuff comes up while you're participating in those programs. And then lastly, we've also been working to address some of the barriers to access, because we understand that with all of these services being made available virtually, not everybody has access to those programs and services. So we've hired an outreach worker at Stella's Place who's helping us to connect with folks in the community that might not have access to some of those virtual supports, to figure out sort of what are the barriers and figure out some program planning to help us make sure that those folks that can't access right now through virtual supports are still able to get the support that they deserve.
For sure. Mahalia, what about you? How has virtual services really impacted a lot of young people who are seeking care right now?
Yeah, deeply. That's like the long and short of it, that's like seriously deeply impacted a lot of young people right now. It's impacted available services, access, as well as our own referral process and options and stuff for us in the Emerge. Access, and it's interesting, I think as Allison was speaking about earlier as well, access and accessibility, as well as like privileges and marginalizations, that come along with these things. They've been inequitable forever, but they've become even further the inequities have been highlighted even more during COVID. And so because of this shift to virtual care, it's meant that a lot of young people, especially young people experiencing homelessness or houselessness or other forms of marginalization, or folks without access to Wi-Fi, folks living in unsafe or uncomfortable housing situations where maybe you don't have privacy, it's greatly impacted that ability to access care. And arguably, those are also like some of the young people that are in greatest need of care right now, greatest need of support. So a lot of times, it's interesting when a young person will come in, one of the things that I hear a lot is, I'm so glad I was able to talk to someone in person, because it's been so long, it's been such a long time. But I would say that it's definitely bred a lot more creativity on our end as well. So a lot of times when I'm working with a young person in Emerge, it looks like trying to figure out how I can connect them with services while we're physically here together. So it looks like, okay, so you're here, and after you leave today, you can't fill out this intake form after you leave. You can't do this or that after you leave. So like, I'm going to call you from your room. I'll be on my little computer and I'll be filling out this intake form for you. Or we'll figure out how to get you funds from here. We'll do that while you're still here, because you're going to be here for a couple hours. I'm going to be here for a couple hours. We might as well get something going while you're still in the same room as me or still in the same building. So a lot of it is trying to get around some of those COVID restrictions, or not COVID restrictions. We're not getting around COVID restrictions, but we're getting around some of those virtual restrictions and different difficulties with access to care in the Emerge by trying to make them slightly more accessible. Having said that, though, I also would like to say that like a lot of the community health centers here in Toronto and other like outreach organizations have been doing such amazing work to try to do their best right now to get people access to some types of in-person care. So even with that, a lot of times it's about doing like a call while someone's here, like, okay, are you open? Yes, no, okay, all right, you can go, you can't go, that sort of stuff. And taking regular calls to these organizations to figure out how it is that their services are changing, so that we know when we're referring someone someplace, when we're giving them with that Presto card, it's like, okay, there you go, run, here's your map, get over there, that we're sending them somewhere that is actually effective. We're not sending them on some wild goose chase, and making sure that like folks are able to get their care after they leave. But of course, trying to make sure that the bulk of the work, the bulk of the burden is taken off of that young person, and we're able to get as much done as possible while they're in the Emerge.
That's great. It's good to hear that there's still so many ways that you can help despite all the restrictions that are in place. And I think a lot of us know that having a social circle and having any sort of life in this last year has been definitely difficult. So Erin, I want to go to you. How have you been creating and maintaining your social circle during this whole past year?
Yeah, it's been kind of interesting for sure. I currently live alone. So for me, it has been really huge to be able to get outdoors and have, safe and physically distanced walks with friends. I think, now it's a little bit more difficult because we have kind of had to think a little bit more about how we're doing that and if we're doing it in safe ways. But to me, I have a lot of virtual interactions. They don't really replace human interaction. So whenever I am out getting groceries in a parking lot, whatever, I try and make the most of the social interactions I have there. I've always been that kind of person. I will talk to anyone about anything. And I think it's been very, very helpful for me now because we don't have very many opportunities to see people in person. So that's been huge for me. I see my family every couple of weeks, which is also nice, but it's definitely, I think, challenging for a lot of young people, especially if they are university students too, because I know that it's a very isolating and disconnecting experience for many people in normal circumstances to be a young person. And now the circumstances that we're in, I think, exasperate all of that. So it's definitely challenging. So I feel lucky that I'm able to see people and do it in a safe manner. So I can't complain.
Perfect. Thanks, Erin. I want to go to you, Christine. What are the next steps for the peer support program? Do you guys have any hopes and goals for the future and how the program is going to evolve?
Yeah, sure. We really want to be able to share our lessons learned in our program here with other institutions and agencies. And the biggest thing we want to do is to do some research and gain some feedback from the young people themselves to see how the program's running, how, if anything, we should be doing differently. So sort of fine tuning our program and also seeing how sort of systemically, if we can do any more help decreasing stigma, raising awareness for this age population. So it's mostly sharing and learning that we're hoping to continue to do. And of course, increased time in the emerge, right? We have 2 right now. It would be great to have them there 7 days a week, longer hours. But anyway, we're moving forward. It's great.
Yeah, that's so great. And Allison, since you're with Stella's Place, what role does Stella's Place play as a community partner in this way?
Yeah, well, I'm obviously a little bit biased as being, with the community partner organization, but I would say that really a project like this should not be taken on without the support of a community organization. Stella's Place, as Jenny was mentioning off the top, Stella's Place knows peer support. We've been doing peer support services for over 5 years, and all of our staff are well versed in exactly some of the nuances that come with providing peer support services. Obviously, the hospital specializes in those medical services and those clinical services, but they don't specialize in peer support services. And peer support services do have their own nuances and approaches and system of values and things like that we really need to make sure the peer supporters are adhering to when they're doing this kind of work, no matter what environment they're doing it in. So Stella's Place has been able to use our expertise to help this project in a number of ways. I think you mentioned a few of them off the top of today's talk, but we've really been able to help them with some of the role descriptions, for example, and just making sure that the role descriptions are accurate about what a peer support worker should be expected to do within an environment like this. We've been able to help with some of the screening and interview processes just to make sure that they're looking for sort of the right sort of criteria when you're hiring peer support workers, since we've been doing it for so long ourselves. And then, as Buke mentioned, the training. So Mahalia and Yolanda both went through a formal Stella's Place peer support training program that was adapted to the emergency department environment. So that really sort of prepped them to understand how they can take the peer support values and take their lived experience and how to draw from that experience in a way that we know is super effective when we're supporting young adults. So it really is truly an equal collaboration between Stella's Place and Sinai. We really, really try to support the program as much as we can. And the last sort of piece that we do get to help with is some of that community connection piece. So since we are a community organization that supports this exact age group, we're able to make sure that the young adults that leave the emergency department can get picked up by Stella's Place or another organization when that's appropriate as quickly as we possibly can. So we really try to make sure that it's a warm handoff for any patients that leave the emergency department and then head back out into the community. And we really try to make sure that Mahalia and Yolanda are familiar with some of the community supports that are available for young adults to make sure that they're making really good referrals and that youth are really supported once they leave the emergency department.
Awesome. Mahalia, you've told us about what young people can expect when they're going through this, but can you kind of guide us through how a young person might experience the emergency department?
For sure. Yeah, so when a young person first comes into emerge, there are 2 primary main ways that they can access care. So first, they'll either bring themselves in from home or from wherever it is that they're coming in from, or they'll get brought in from some emergency service. And when they first arrive, typically there's that usual, you go to triage, you'll explain sort of what's going on, what you're here for, all of that. You get sent off to registration, you wait in the waiting room for a little bit. And at that point, there's a possibility that a peer supporter will come out and we'll see you there and you're in emerge, just check in, say hi. We'll usually check in again once you get in. just to see sort of what's going on, how we can best support you. We recognize that there's also like some pretty long wait times sometimes, depending on what's going on in Emerge, depending on like how it is that you've been triaged, all of that. So trying to make sure that you're still a bit comfortable while you're in the waiting room is one of the things that we like to look for, how long someone's been there. So for a lot of folks, yeah, we see them while they're in the waiting area. For a lot of folks as well, we also see them again once they get in. And the amount of time we spend with them really depends on whatever someone needs. Sometimes it's 5 minutes. They're like, okay, cool, I'm good. We've spoken for 5 minutes. I feel solid. Check in on again in like 33 hours or something. But for other folks, I've spent up to like 4 hours just working with someone, which is like a solid amount of time. It's something that I'm glad that we're able to do while we're in the Emerge, to have someone sit with you for that amount of time. But then, of course, once they're seen by their care team, so like their physicians, their nurses, their nurse practitioners, physician's assistants, all of those folks, they're going to go over again sort of what's going on. There's a lot of, sharing of stories and stuff while you're in Emerge. A lot of like, okay, this is what's going on. All right, this is what's going on. This is what's going on. You got to say that a number of times while you're in Emerge, just to make sure that like everyone's on the same page and we know sort of what's going on with you. And again, like Dr. Organic mentioned from the beginning, that confidentiality piece is still a thing, especially for young people as well. So even if you are a minor, there is still confidentiality in place, of course, with like the certain limitations in cases of like danger. But for the most part, that does remain paramount for a young person's time in the ED, and nothing is shared without your consent or without you being okay, without you being on board. And a lot of times as well, you're also included in those conversations. It's something that I really want to highlight for young folks as well. Anyone who might be considering accessing an Emerge or is going to have to in the future. It can be a bit daunting when you talk to a doctor maybe about something that's really personal that you haven't yet told someone else in your family, haven't yet told your parent or guardian or whoever it is that you're living with. Timed lights, great for the energy and the economy, but it's difficult for these Zoom situations. But it's really important that that there is still like a lot of confidentiality involved, that nothing is going to be divulged without your own say in the matter. Yeah.
Nice. That's so important. Dr. Organic, I want to go to you. So what supports would you like to see that's added to the provided in the emergency department as a doctor? Oh, you're just on mute. 2021 problems we have.
Thanks. So our teams can always learn more to better understand how to provide good care for youth who are seeking help for mental health and addictions. I think we absolutely must improve our collaboration with and understanding of the community resources that are available. And obviously this differs from community to community. I'd like to see, every hospital creating more reciprocal learning opportunities and developing these with our incredible community agencies that are out there. Some other kind of little specific things, the physical spaces in our departments could always be better. The rooms that we use for mental health care, when even they are available, and in many hospitals they don't exist, specific rooms. These are often quite uncomfortable, can make people feel worse in these in their moments of crisis. So I think that's something we can always improve upon. I think our departments need to get better at improving sensitivity towards certain populations within our care. For example, our charts at Sinai have recently been updated to include a prominent place for patients' preferred names and pronouns to help prevent misgendering and dead naming. But this is only one tiny step at making the emergency department a friendlier and more accessible place. We have a long way to go. Access to mental health workers, crisis workers, psychiatrists, social workers, and peer support workers is highly variable depending on which hospital, which department, the time of day, the time of night. The more we can strengthen this, the better we'll be able to support our patients and our communities.
Thank you so much. And that is the end of our time with the panel. Thank you very much for all of the panelists who joined us today. And we did receive so many wonderful questions, and we unfortunately could not get to all of them, but we still do want to answer them. So if you were unable to get your question answered, we do have them all tracked, and you are going to hear from a staff member who is going to answer your question individually. And just a reminder that today's session, it doesn't replace medical help. So we will be circulating in a follow-up email a list of resources if you or somebody that you know is in need of some support. And up next, I want to call on someone from RBC who made this program possible. So welcome Rameen Fazzell, RBC Regional Vice President of Toronto Downtown.
Thanks so much, Shannon. It's such a pleasure to be here. Good afternoon, everyone, and thank you for having me. What a terrific event you've put together, and I'm so humbled to be a part of the celebration and this partnership with you. Only a few months ago, we got the news that the 100th patient had been helped thanks to RBC Pathways to Peers. And this is truly an incredible set of news that we heard, and it confirmed just how necessary this program is in our city. At RBC, we take pride in helping our communities prosper, but most importantly, in seeing the direct impact it's having on those around us. Right now, there's 1.2 million Canadians struggling with mental health, and this is not something we take lightly. In fact, it's our collective responsibility to ensure we're building opportunities for people to feel both confident and comforted when they reach out. Yes, RBC Pathway to Peers is helping young Canadians in distress, but it's also advocating against the social stigma of mental health. So it's an honor to know that together we're working hand in hand for a common cause. Thank you again for having me, and thanks for all the participants. From what I understand, we have over 300 individuals who've taken the opportunity to join, and incredible kudos to you for taking the chance and putting up your hand and wanting to learn more about the resources available. So thank you.
Thank you so much, Rameen and RBC, for those words and your unwavering commitment to helping youth in our community. So as we get close to the end of our session today, I'd like to introduce you to Howard Sokolowski for closing remarks. So Howard is co-chair of Sinai Health Foundation Board of Directors. And as a dedicated volunteer and philanthropist, Howard is committed to supporting healthcare and the arts. So please give a warm welcome to Howard.
Oh, thank you so much, Shannon. And I am so incredibly honored and privileged to be here today with everyone here. It has just been such an exciting discussion. And I want to thank Shannon, and I'd like to extend a thank you to all our speakers and guests who shared their work with us this afternoon. I know I can speak on behalf of all of us when I say we are so proud to be part of the work in some way. As you know, we are all here today because of our generous community partners, RBC, who strongly believe in Sinai Health's power of care. Thank you so much for your tremendous support and your trust and your investment into Pathway to Peers. I have been doing business for over 35 years with RBC, which makes me old, but the truth is it's been for 35 years, and for 35 years, RBC has never once failed to answer the bell when I or friends of mine have gone to RBC to reach out to them to help for the community. It's been a tremendous journey with myself and RBC. So thank you so much. And I want to give a special shout out to Dave Mackay, you'll kill me for saying it, Dave Mackay, Jen Torrey, Kevin Murphy. Kevin Murphy was with RBC when we organized the beginning of the fundraiser event. And of course to Rameen, thank you for being here today. Sinai Health Foundation is so grateful to our philanthropic community for their unwavering support to this unprecedented health crisis and answering the call to help those who have been affected most by this pandemic. Donors are important members of our community, and support from that community is essential for advancing research, care, and outcomes for those facing mental health and addiction issues. Thank you to our speakers today, Bug, Mahalia, Christine, Jenny, Erin, and Andrew. You bring hope for better care and outcomes for young people who are living with mental health and addiction issues. Your work continues to inspire us, the philanthropists. And I also want to say a special thank you to Shannon for emceeing this great session. You did a great job, Shannon. Thank you so much. The care Sinai Health provides has the ability to change the way patients are treated all over Canada. We are seeing programs like Pathway to Peers being implemented in other Toronto hospitals. The Schwartz Reisman Emergency Center and Mount Sinai Hospital and Sinai Health as a whole has an unwavering commitment to deliver the best possible care to its patients. Sinai Health's patient-centered approach means our people will always persist until they have all the answers. So I would like to thank again everyone for attending this afternoon's session, and we all work together to strengthen the community supports available for young people. We will be circulating a recording of this session in case you wanted to share with anyone else who wasn't able to join us today. Thank you so much for joining us this afternoon, and be well and be safe. Thank you.